public policy in cancer, and we're going to give a framework to that with you, Nancy.
So I think public policy is really the essence of the concept of a government that is both laws and individuals. Public policy is really about the laws that we pass on the federal level. They're signed into law by members, by the President of the United States, and they're passed by members in the House and the Senate. Public policy also incorporates the passage of laws that are within state government affairs. Public policies then have to be regulated, and so we have regulators at both the federal level and at the state level that contribute to public policy decisions. I think for all of us, public policy is really about our culture, our philosophies as a people. Public policy establishes the platform from which our entire society is going to interact with one another. And public policy is really what a lot of people are talking about every evening around the dinner table.
How did the patient advocate community become such a propeller for being involved in public policy and a role model for, I'm sure, other disease types, and sort of the root, the genesis of public policy and oncology?
Public policy in terms of patient advocates really initiated in 1954 when Jonas Salk was in the lab trying to find a drug that was going to control polio. And it moved from there to HIV/AIDS. And then it moved into the cancer community, because what we saw in the cancer community is we were finding new therapies that our regulators and our insurers were electing not to really pay for consistently. And so the move to advocacy was born out of two needs. Number one, find a way to control this disease. If you can't cure it, control it. And number two, the solutions that you find, make certain there's a vehicle for reimbursement. And through public policy in cancer, we work now in the area of research and the FDA. We work in public policy to assure there's reimbursement for treating physicians. We work now in public policy to make certain there are laws that will advantage different disease groups in cancer. So it's a very historic area that has been heavily accelerated since the late 80s.
Let's talk about where ASCO is in the public policy setting.
ASCO, as you know, has many groups and constituencies within it. And there are many committees that deal with such things as clinical practice, research initiatives, state society and state affiliate activities, and on and on. And the Government Relations Committee, which I participate in, is basically where the rubber meets the road with respect to all of the policies that bubble up from within the various silos of ASCO and policy initiatives that need then to be connected with our elected officials. We have to identify the members of the House and Senate and the various committees. We have to identify the appropriate staffers and folks that actually do the work behind the scenes in our halls of government, and we have to advocate for the positions that will both help our physicians and our institutions provide the cancer care to all those that need it in our country.
If you go to the ASCO website and you look at the public policy issues, I'll name some of them that are on the site to give context to a good example of what public policy covers: drug shortages, advanced cancer care planning, NIH, NCI, FDA Appropriations, access to care, value in cancer care, drug safety, reimbursement, Medicare. So those are all such significant. I mean, it's the core of oncology.
And all those things are important, and they bubble to the surface at different times of the year when various appropriations bills are being debated. For example, recently the PDUFA legislation was being discussed in Congress, and there were aspects that related to the drug shortages and ways to manage that problem that were contained within that particular bill. So all of those areas have to be addressed at the proper time and with the proper folks in Washington.
From the ASCO perspective, talk to us about the way in which ASCO interfaces with the advocate and patient community on behalf of these common initiatives, goals, and needs.
We have strong relationships with the cancer survivorship groups, with patient advocacy groups, and we bring practitioners and experts in the field together on a regular and ongoing basis to discuss all of these issues when they rise to the level of prominence in the public dialogue. And I think that that's one of the advantages of an organization of this breadth, is that we have the expertise within the membership and within the academic institutions and practices that it represents. We can bring the right people to the right place at the right time to discuss these issues.